how to decompress your mid-back, fix your pain.
So we're
long
talking
spine.
here, not here, but we're talking about right here at the thoracic 12 vertebra right in here. And there's some
Starts at T1,
Yep.
which is thoracic 1.
Yep, T1.
Goes down to thoracic 12.
Right.
Quite often when I feel pain in the low back, it's actually from the mid-back. It refers down.
Right.
Pain for the low back often goes down into the back.
Right.
So I would first check their motion. So you want to check your motion, and the main motion of the mid-back is rotation.
Right. Right.
So I would check which direction hurts.
Yep.
Does that hurt? And is it restricted? Then
I
also
or painful
to the left.
too, right? Yep.
Yeah.
So the motion and pain kind of take note of
Right.
those.
I have you work into the non-painful direction.
And I do want to mention, if you do assess your motion, make sure you're doing it in a seated position, not
the pelvis
standing.
should be stable.
Right.
I want to mention you shouldn't do this on anybody who has rheumatoid arthritis, or if you have a lot of laxity or double jointed.
Right.
I don't want you doing these.
Or if you've had any previous surgeries or things like that on your spine, you know, those red flag things.
We know now, let's say, for example, we found out that twisting to the right bothers you. But we're going to use the hanging handles. These work really well because while you're hanging, the wall supports you. First thing you're going to do is just work on traction.
Yep.
You're going to slowly work into it. It might be a couple days that you do this.
Sure.
Even. And you can control the amount of traction you're getting or decompression by your feet.
Right. Yeah, go to the point where it feels good. Give it some time. It may take a few days for things to decompress and get to normal. And
this is not a painful maneuver.
No, if you're feeling pain, you stop.
Turning to the right like this is actually similar to moving the legs to the left.
Right.
So we're not going to have Brad move his legs to the left. We're going to have him move to the right.
Let's say I'm to the point now where I feel comfortable, feels good to have the traction on. And, you know, I can hang there as long as my grip is fine, you know, 20 to 30 seconds maybe or less. So I'm going to rotate this way, assuming, oh, that feels good. Everything is going good. It actually feels better. You might put your foot up on a stool there. You don't necessarily have to do that.
Right.
But you can trial with level here or here. And
the further you bring your feet, the higher up the thoracic spine you go.
For me, I go up to here and it clearly feels better on my low back. Right around the belt line, I can feel that stretch.
So after you do this, I want you to retest. And he rotated to the right.
Ow. Yeah.
Now, he worked on going to the left, but that often improves rotation in both directions. So you might try it again and say, oh, I'm going a little bit further, or, oh, that feels a little bit better.
Yep.